Hey everyone, what's going on? Dr. Kuntz here. Welcome back to the Primetime Podcast. I hope you're having an awesome day, and I'm stoked to be here. You know, I think as I get older, I just practice gratitude as much as possible. Life has its ups and downs, as I'm sure you know. And you know, some days you look outside, the sun's shining, you're able to walk around, you feel pretty good, and you know, it's like life's pretty good. Sometimes you just got to continue to practice gratitude, but nonetheless, I want to hop on today, guys. Actually, I had a lot of great feedback after our most recent podcast session where we talked about how you can get back to playing golf and tennis after rotator cuff surgery. I received a barrage of emails and texts and what have you about people who've also sustained a back injury who are looking to get back to playing golf and tennis. They've got a country club that they belong to, or maybe it's just a sport that they want to keep playing that they played when they're younger, and they're kind of curious of my thoughts on what that's required. So we're going to take that time today and take your suggestions to kind of walk through what needs to happen. So kind of where we left off last time, we actually finished up talking about the importance of how the entire body needs to support where the injury is. So in this case, let's kind of think about the back and its kind of implications into tennis and golf. With tennis, as you know, we break it down as you go into a serve. The back is required to go into a significant amount of extension. All right, extension is a really tough move on the spine, in my opinion. Just in the sense of having treated hundreds, or if not thousands again at this point, of backs with these two sports, I found that most spines are very sensitive to extension. We'll touch on this a little bit later, but we've also got the concept of rotational movements or shear forces to the spine in both sports. So with golf and tennis, the rotational component is a lot on the spine. As you go back into a backswing or a forehand for the spine, you're required to do some level of rotation, depending on if you're righty or lefty. And then as you go through your forward swing, your follow through, or the backhand, again, there's rotational components there too. So in both these sports, we've got that to consider. And then thirdly, we've also got a side bending component. So side bending, if you could imagine when you're listening in on the podcast, if you're standing up straight, and if you, for example, reach towards your right heel without kind of leaning your trunk forwards, that's a side bend. Side bend is a very aggressive move on the spine, and in particularly for the facet joints. Facet joints are just like these little pieces that kind of stick off the spine, and they kind of sit side by side to each other. They can enlarge as you get older, but what happens is that sometimes if you kind of pinch them or you compress them, they don't really like that too much. In fact, not only can you get some compression to the facet joints, but you can also narrow down the space in the intervertebral foramen, and that can irritate the nerves. So we've got that to consider, and really all three of these play a pretty strong role in both tennis and golf. In golf, when you go into your backswing, the lower right bottom portion, if you're a right-handed golfer and the lower lumbar spine is being compressed, that's where, in my experience, golfers are relying too much on a side bend motion. Now, if you go back into our overhead serve analysis and thought process, that spine's going into, again, significant amount of extension, and there might even be a little bit of that side bend component. So what do we do about this? How do we get back to playing these two sports if we suffered a back injury, and if we know that the nature of both these sports is actually quite aggressive on the spine? Well, let me just start out by saying this. Most people overuse their back, their lower spine, in both of these sports. So that's the good news. The good news is that there's things that we can change to help get you back to doing this. It's not like you're just stuck at a dead end. For example, when you go into your serve, most people are very limited in two adjacent areas to your lower lumbar spine that ask your spine to do more work than it needs to. It's kind of like having 10 assemblymen line up to do your work, but your lower lumbar spine is making up the work for like 7 other people. 7 other people are having a coffee break and just sitting outside in the back room, and the lower lumbar spine guy is like, well, I guess I've got to do all the work around here. This isn't really fair. And it's not to him or her, depending on what you want to call that person. So all of a sudden, this guy is working, 18-hour days doing all the labor. At some point, it's going to knock on your brain's door and just say, I can't do this anymore. This is too much for me. So as we go back to our overhead serve analysis, what are the two adjacent areas that need to kind of make up the slack? It's going to be your thoracic spine, or the spine that sits just above your lower lumbar spine, and your hips. And guys, if there's nothing else that you take away from this Prime Time podcast session, it's that your thoracic spine and your hips need to be readily improved and strengthened and arguably immobilized so that you can get back to doing these two sports with a significantly less degree of pain or discomfort or aches because of the assembly line analogy. The lower lumbar spines too often become our most hypermobile, or most, you could kind of think about it as overused or overworked or loose part that eventually causes some compression, it causes irritation, and causes your discomfort. Now, in the case of rotation, I also find that the lower lumbar spine does a majority of the rotating. Your hips are not rotating, and that's not really the way we were intended to move. In fact, the lower lumbar spine really wasn't intended to move that much into rotation, yet we kind of force the action. In reality, the lower lumbar spine should actually be stabilizing, aka your core. Your core needs to be really strong and educated, that needs to fire first to stabilize those segments so you don't get as much motion. For example, let's kind of dive into this. There's a muscle called the Transversus Abdominus. You might have heard of it if you've been in and out of rehab for any point of time for your lower back, but if not, that's okay. The muscle sits way down deep and actually attaches to your spine. Okay, we call it a local muscle because it's actually got influence on each and every individual segment, which is pretty profound actually. Now get this, so that muscle is kind of your anchor. It's kind of your forward-thinking anchor in the sense that, let's say I go to raise my hand. Before my right hand even moves, for those of you that are listening to my podcast, before my right hand even moves or gets overhead, my transversus abdominis should have tightened. It should have tightened, and I say that because if you've had back pain before, guess what happens? Nothing happens. Nothing happens. Your muscle does not fire. Your muscle does not contract. Let's take it a step further. So as I get my arm all the way overhead, for those of you who have maybe never suffered with back pain, this muscle is already firing. It's doing its job. It's stabilizing the tree root. We're good to go. We can stabilize. We can now reach back with our hand, whether it's a backswing or a backhand or a forehand, and it's stabilizing that lower lumbar spine. We'll use our muscles now to generate force and elongate and move that ball the way we need to. Versus those of you that have had back pain, that muscle is late to the show, late to the party, and it's already allowed more movement that needs to happen, and you put yourself at jeopardy for pain. So that's where there's actually a very strong re-educational foundation that needs to occur that I found for those of you that have had back pain in the past. And it's kind of interesting because when I start to train people, people kind of get frustrated because they realize after I give them some cueing and they can feel that muscle's not firing. It's kind of like, well, what the heck? Why isn't that muscle doing what it needs to? And the difficulty, the trouble is that it's at the subconscious layer. So we've got to reconstruct. Actually, we've got to demolish the building and then rebuild it. That's kind of the way I think about it. Deconstruct and then reconstruct your movement patterns and your neurological connection between your brain and your core. I put a lot of weight in that. I really do, because of the idea that the low back ends up moving too much and it kind of slips and slides, if you think about it, like a car that has really poor traction on the wheels. To help with that, we need to have a better driver who's in more control. And even though those tires may have lost some tread on it as we get older, we need to have a better driver who's better to predict where he's driving, how fast he's going, and what the future holds. And that can save a lot of spines as it is. So there's that component. The second component I realized to help get people back to playing tennis and golf is that we have a tendency to really guard in the wrong spots down there in the musculature. So myofascially speaking, muscles like the quadratus lumborum, or even muscles in the oblique area, even the good muscles, so to speak, in your core, can have myofascial tightnesses and knots that kind of limit movement down there and actually can cause pain. There's even some kind of deeper muscles that run up and down the entire spine called the erector spinae or spinae. And those muscles can really kind of lock down the spine as well. And the last muscle I'd want to mention is actually the upper part of your glute max that wraps around your lower back. It's got some fibers that kind of attach into what's called the thoracolumbar fascia. And basically you could think about the muscles in the myofascial tissue not having the extensibility that they need. They're guarded because the brain's nervous about protecting the low back. They overguard, they get over tight. They can actually cause pain in there and limit movement in the general vicinity. So I've found a lot of success kind of working on the lower outside or lateral sides of the back with my hands, doing some deep tissue work to kind of free things up. And I've found that sometimes you got to just keep knocking on the door and do some repetitive work. Not forever, but maybe after an injury, maybe it takes 6 to 8 weeks, once a week, where you kind of get your hands on that tissue before the muscle finally goes, okay, we'll let go. But you've also got to give it the justification to let go. So that's where strengthening up the core, strengthening up the muscles actually plays a really big role. And then lastly, I just want to kind of point out the importance of hip rotation to help offset the back. So let's use a right-handed golfer who's going into a backswing. So when he goes into the backswing, hang with me here, the left hip has to go into external rotation, where it kind of rotates out, and your right hip has to go into internal rotation. Even if you don't have a good idea what that means, it's okay. I want you to know that there's some rotational qualities that have to occur within the hip joint itself to make sure that it can help offload the spine. In fact, it's not just rotational. So there's also the idea of, just for the purpose of visualizing this, imagine standing and like kicking your left leg up straight up toward the ceiling. Okay, you could kind of think about that move as abduction or lifting your leg out to the side. There's also that motion too that's involved when you're even standing on the ground and you're going into, let's say, that backswing. So for simplicity, if your hips don't have the motion that they need to, guess who's doing your work again? The back. And so there's also not only the thought of opening up motion in the hips, but also getting you to learn how to kind of tap into that to actually use that, right? It's one thing to have the motion. It's another to learn how to actively control that. And that's really the definition of mobility. We actually had a discussion on that on our podcast before, the difference between flexibility, stability, and mobility. Go back and watch that if you need to refresh that, or if you haven't heard it, or maybe this is your first time hopping on to Primetime. Because mobility is a really important key here, and that's kind of what I'm getting at. The hips not only have to be flexible, they have to be stable, right? Because they're loading a lot of weight, but they also have to be mobile. If you can kind of visualize the head of that femur inside of the acetabulum, that baby needs to rotate and move and compress and depress. It's got a lot of degrees of freedom in there, and your hips must be the king for your mobility, to get into your backswing, to get into your forehand or your backswing, and to generate force, right? And to generate force in a way that's not coming from your low back, but it's coming from your core and really the entire dynamic chain. So as soon as you plant that left leg, maybe as you're coming through with a forehand, the left leg needs to be strong. The left ankle needs to be stable. The knee needs to be strong, generating force. The hip needs to continue on that chain of strength. Now, it transitions into the core. The core needs to be able to control some level of rotation to allow the spine to rotate and to control that. The thoracic spine needs to rotate and essentially be a great area of a combination, again, of flexibility and stability as it rotates and opens up. The shoulder has to have a great degree amount of rotation. The shoulder blade needs to be moving the way it needs to. The elbow needs to be attenuating force as it comes through. Do you see what I mean? It's an entire game here, a chain of events. So think about really in slow motion, visualize that, and as you go into that foreswing of a tennis player, or as you get into the contact with a golf ball, think about the requirements of how each and every joint and muscle and body and connective tissue and ligament is working or isn't working. So if there's a weak link at any point in time in that, all of a sudden the ability to attenuate force throughout that chain has been jeopardized. And at some point your body will find a way to do a work. You really want to hit the hell out of that ball. You want to beat someone. You want to compete. You want to stick that 7-iron. You think your brain really cares about where it's coming from? Not really. That's where you have to train it and exercise it and make sure that you're doing the job that you need to, working with a skilled professional to find all those weak links and to address them so that the chance of injury is significantly less and that you're supporting the really most likely areas to be injured. And we've covered really the two top areas that are tend to be injured with both tennis and golf in these last two primetime episodes, with the shoulder we did last time and then the back today. Whew, good stuff. So let's leave it there, guys. I think that's plenty. I think that's a lot. But again, remember, if you've had back pain, hips, thoracic spine, make sure you work with someone that can break down your swing in a slow motion fashion. It's pointless to do a generalized screening without looking at the specificities of what's required for your sport and the way you move. All right. In both of these sessions, we really haven't even talked about your form, your technique based upon your anatomy. So I'm kind of just coupling that up into the idea and notion that, of course, the specificity of the sport needs to be outlined. We need to slow things down because you in the clinic demonstrating something versus you actually doing it on the tennis court or golf course can be completely different. So we need to capture that in a video and then break things down to see what's actually happening to get the best level of detail, to give you the best chance of succeeding at getting back to tennis and golf. Awesome stuff. Thank you guys so much for tuning in. Any questions, feel free to shoot them out at chadk@pr1memovement.com. That's chadk@primemovement.com. Feel free to do that and we'll go from there. Thanks guys, have a great one.